Good evening, everyone. I'm Dr. Kiran Ladkat, hand surgeon from Chasanal Hospital, Mumbai. In a countdown to VIRAC 2025 interesting case series, I'm presenting a case of proximal interphalangeal joint fracture dislocation, a coronal split in condyle. Now, this particular case is a 38-year-old gentleman, anti-professional, right-handed, with a middle finger closed injury due to cricket ball while catching a throw. This particular fracture pattern extends from volar lip to one of the condyles, with coronal split and a spiral component. The case in discussion has a significant around 50% of the articular surface of the volar lip extending onto the radial condyle of the middle phalanx base, causing subtle subluxation and a V sign being positive, which you see on a zoom in of the X-ray. Now this V sign is seen onto the middle phalanx dorsum at the PIP joint. This particular picture shows the mid-axial approach with darker dorsal skin and fair volar skin, through which we have approached in the mid-axial plane, and we could restore good compression of the fracture and articular congruity in both AP and lateral planes. As you see on the lateral view, the volar lip is restored well, and on AP view, there is good compression of the fracture with good reduction in the joint space. As you see post-op function, there is subtle bump due to the scar, but scar is seen on the mid-axial plane. As you go further into the video, patient shows good functional range of motion, full range of motion in the function. So to conclude here, in an isolated finger injury, always ask for finger AP and lateral view. Understand the fracture geometry well, and mid-axial approach is practical and safe approach for this coronal plane fractures. I invite you all for VIRAC 2025 in December this year. Thank you.